So this is the 75th anniversary of the beginning of the Champaign Public Health District. And we are so happy today to have as our speaker Julie Pryde, the Public Health Administrator of the Champaign-Urbana Public Health District. Ms. Pryde received both her bachelor's and her master's degrees in social work from the University of Illinois, Urbana-Champaign, doing internships at the Public Health District for her bachelor's and at the Veterans Administration Hospital in Danville for her master's. She began working at the CU Public Health District in 1995 and has been the chief administrator there for the past 5 years. Ms. Pryde is an accomplished grant writer, researcher, and speaker, publishing in professional journals and presenting at such national conferences as the International Mobile Health Conference, the U.S. Conference on AIDS, and the National Harm Reduction Conference. She has received the Joan Severance Award given by the Greater Community AIDS Project and the Red Ribbon Award for taking it to the streets from the Illinois Department of Public Health. She currently serves on the Community Advisory Board for the Illinois Morbidity Monitoring Project and as a is a board member of Mobile Outreach. Please help me welcome Julie Pryde.
Oh, thank you. As if this wasn't nerve-wracking enough, one of my favorite professors from college is here, Dr. Gullerud. So that is kind of exciting. Let me see, I need to get my presentation up. Let's see here. I am very pleased to be here on our 75th anniversary. I am excited to speak to this group in general. I see a lot of people that I've dealt with, former board members, people that have been instrumental in getting the county program started. So that is exciting. I would like to recognize Barb Wasaki is out here, who was a board member when I was on there, and of course Jan Anderson, who is instrumental in getting the county board. And our current county board of health member is Betty Siegel. So this is a stressful group for me to present in front of. I'm kidding. They're very nice. Are they going to put the presentation up? So there it goes. Okay. I want to just start out with letting you know what public health is, because very few people, including most people who work in public health, don't really know what it is. They hear health and they assume it's a clinic type of thing. Public health is actually the science and art of preventing, and that's the key, preventing disease, prolonging life, and promoting health. And again, here comes some more key things, through organized efforts and informed choices of society, organizations, public and private communities, and individuals. What that means is that we take a macro approach, and we look at the person in the environment, not, which of course is why social work and public health fit so well together, is we don't just look at the individual and their behaviors, it is efforts aimed toward community change and community transformation. What does Champaign-Urbana Public Health District do? Well, our mission is to improve the health, safety, and well-being of the community through prevention, that's key, education, collaboration, which we're very, very big on, and regulation. And regulation is the part of it that you know, is the little uneasy part for some people, because that usually involves we have the power to quarantine and isolate. Luckily, that's very rarely used. And we also have, of course, the opportunity, or I don't think opportunity, but with the ability to close down a restaurant or a food establishment should there be a problem with that impacts the public safety. I can tell you I get calls all the time for everything under the sun. Pretty much in the general public's mind, if it's gross, call public health. If you don't know what to do with it, call the fire department. But if you don't know what to do with it and it's gross, call public health. So I get all kinds, and being that I'm a good social worker, I take those calls and I try to make an appropriate referral in the community. So we do like hearing from everyone. Okay, what does public health do anyway? Well, I'll tell you what we don't do. Sometimes that's easier. We are not public medicine. Public medicine is what, in our community, Francis Nelson Health Center is, the federally qualified health center, or it used to be called, low-income clinics, or or something along that nature. But what it is where people go to get their primary health care. And in Champaign County, that's Francis Nelson Health Center. And that is not public health, but it's very confusing to people because they don't know, a lot of times they don't know the difference. And we have lots and lots of people coming to public health for those services. And I think what makes it more confusing is that we do some services that are considered, we have an STD clinic, for example. We do dental care, things like that, so that it makes it kind of confusing. We are not a convenient care center. We have people coming in all the time saying, can you look at me, or can you talk to me, or I need to see the doctor because I've got this going on. In our community, those are Carl, Christy, Pravina. We are not a convenient care. We do not offer any services like that. We're not a social service agency. And you're like, but it's ran by a social worker, so therefore you must be. Well, we kind of are. We're not a social service agency like Family Service or Regional Planning. We work very, very closely with all of these agencies. Champaign County is an amazing place to work in any type of, well, certainly in public health. I think that people are very envious when I go to a lot of state and national conferences and I talk about our community, and it's because we do all work so closely together. We know what services are out there, and if somebody calls, we don't just say, no, we don't do that. We link them to the care that they need, and we really go out of our way. And it's not just us, it's all the agencies that we work with. And the beauty of Champaign County, too, is if you ask for help, you better stand back because you're going to get help. And I can use the example of when we had the Community Reception Center for Katrina. We worked with Red Cross and other places. And I went on television one time and asked the community to help us gather supplies needed for people who just needed kits, for example. They needed shampoo, soap, toothbrushes, things like that. I went on television one time to ask for assistance. I had to go on television 3 times to tell them to please stop bringing stuff. We were so overwhelmed with help from this community that we ended up sending an entire semi-load full of things farther south to help other places. So it's a really good place, as you all know, to do this type of work. And we are not a free clinic. Even though we have the STD clinic and we have services that people consider free, in town, the 2 free clinics are Avicenna Health Center and Champaign County Christian Health Center. We refer a lot to them. They refer to us, and we try to partner up when we have things like immunizations to do. Okay, why did Public Health District start? Well, we are one of the oldest ones in the state. We started in 1937 for 3 reasons. Venereal disease control, and you gotta love that little picture there on the side. They always blame the woman for the STDs, never the men. Men had nothing to do with STDs, apparently. But so it was started for venereal disease control, and then it was started for milk inspections, food inspections. Today, I would like to say we've taken care of the venereal disease control problem, but I would be lying. We did, however, change the name to sexually transmitted disease. So I guess we get some, so sort of we did take care of venereal disease. And milk inspections, the milk inspections are still done, of course, but they're now done through Food, Drugs, and Dairy, not through the local health department. And we still continue to inspect food establishments, well over 1,000 right now. What do we do now? So Champaign-Urbana Public Health District is a district, and we contract with the county to provide services in the county. And over the history of public health, the services have changed somewhat. It used to be that public health, there was nothing to do but respond to epidemics. This is back prior to 1850s. There was really nothing to do but to respond to constant epidemics. They didn't know where the epidemics were coming from. They didn't know what caused them. They didn't know how to deal with them, so they were just kind of shuffling people around trying to deal with them that way. And then it became, once they started realizing what caused the epidemics and they realized some of the public health interventions, then there started to be some infrastructure growing up around that, and that would be the regulations that are a core part of public health. And I always cringe when people talk about deregulation of these type of things because they're there for a reason. And it's truly, public health is the difference between developing world and developed world. It is public health infrastructure that makes the difference, and we'll get to some of that in a little bit. So what do we do? How are we structured right now? We have the Division of Infectious Disease Prevention and Management. This division is communicable disease surveillance. Now that is a core of public health. I will talk about 4 core services that we have. Safe food, safe water, septic, and the whole point of the septic is to keep the sewage out of the food and the water. That's the whole point of that. And to then communicable diseases. So communicable disease, how this works for public health, and this is truly the invisible part of public health that no one really knows what we do, and it's a huge part of it. There are reportable diseases out there, and people are mandated, physicians, laboratories, they're mandated to report certain diseases to public health. Public health is sort of like the little, data center. We get all this information and then we have to do something with it. Well, what do we do with it? Doctors always learn right off the bat in medical school, if you hear hoofbeats, it's probably horses, right? It's not a zebra. It's probably horses. Well, public health knows when the zebras are out there, and we have to alert the doctors that, hey, you know what? It could be horses, but guess what? There's a zebra in town, so look for that. An example of this would be we recently had a cat with tularemia. Now you're wondering, oh, why do you care about cats? Well, because most of the diseases we're concerned about are zoonotic, meaning that they come over from animals and infect humans. And tularemia, we've had cats with tularemia, a big outbreak last year. People can get that. It's also known as rabbit fever. That's kind of the common term of it. But we had to let the physicians and the ERs and the patient advisory nurses and people know that if clients are presenting with this set of symptoms, it might not just be, whatever, the normal thing. It might be tularemia, so you might need to check for that because it would be treated differently. Therefore, we save time by doing that. We also deal with the recalls, and of course, the situation we just had with the recall of what was it? It was a steroid used for injection into spines. The deal with that is, talk about an issue with no regulation. Compounding pharmacies are not regulated by the FDA. So here people are unknowingly getting these injections into their spine, and lo and behold, there was something in there that was causing them to get sick. It ended up being a fungal infection. So if you're going in there and you're getting meningitis, the only way to know that is, of course, to test for that. And they found out what it was, they traced it back, and then we had to call and make sure that all the places that had this were not using it, that it had actually been removed. So we do that little piece too. So we have this whole kind of hidden world that nobody ever knows about. And it's hard to measure too, because how do you say, oh, well, yeah, we're doing a great job because none of you have diarrhea today. That's not really a good thing to be able to point to and say, we prevented you from getting this, we prevented you from getting this, we prevented you from getting this. But really, the infrastructure is key. And the public health system is not just public health. We are the little center of that wheel. We're that. And then you've got your Carl and your Christy and your Pravina and your Francis Nelson and your schools and your doctors and your veterinarians and your entomologists and all these other agencies that feed into public health and that we have an interactive relationship with. Okay, infectious disease. We also do hepatitis services, TB testing and treatment, HIV and AIDS, and sexually transmitted diseases. We still do that. I don't look for that to end anytime soon. However, had you have asked me 20 years ago if I would still be dealing specifically with syphilis and tuberculosis, I would have probably said no. We'll have those taken care of by then. Well, we don't. TB is roaring back, and we are dealing with it constantly in this county. And when certain diseases like TB or syphilis are reported to us, each disease that's reported to us, we have certain steps that we have to take to address it, to mitigate it. And of course, with TB and syphilis, there are obviously different approaches because they're spread different ways, but we have to go out, we have to interview, we have to contact trace, we have to try to treat the circle around them and try to bring any potential epidemic or outbreak under control. You may know that a few years ago we had a very unusual situation in this community. I had a gentleman with tuberculosis who was infectious, who I put him in isolation, which I have the authority to do, and I can tell you that it's about as useful as telling someone to drive the speed limit. If they're not inclined to do it, they're not inclined to do it. So we had to take extraordinary steps, and in Champaign County, the jail does not have a negative pressure room, therefore they did not want the client in there, which is normally where he would go, nor did I want him in there, because then I would be having to deal with a whole outbreak. So we ended up putting this gentleman in an ankle bracelet and putting him in a hotel, and that was an absolute nightmarish thing for everyone involved. And really the situation with him is just that, he was young. There's a lot of things that impact how people react to certain things. He had TB, he was from a place where TB wasn't really that big of a deal, and he was a young guy. He had things to do. So we had to deal with that. Okay, environmental health. And I always tell people that people think of public health based on what you use the service for. So if you ask a young mom what public health is, she'll probably tell you WIC. It's the WIC clinic. If you ask a little kid, they're going to tell you either that's where I get my shots, or it's the dentist office. They think of us as the dentist office. If you ask a teenager, they may think of us as an STD clinic. If you ask a restaurant owner, they'll tell you we're a pain in the butt. So it's all from your perspective of how you interact with us to, and this is one of our pain in the butt clinics, or not clinics, but divisions, because they have a lot of regulation to do. And so they often, have issues around that. Although we have really good compliance and really high compliance rates in our county. The restaurant owners are, very good. We had, last year we had 13 outbreaks, and the outbreaks had nothing to do with the restaurants themselves. We had one where the sprouts, of course, were brought in, and those were contaminated with salmonella. That's a problem. And then we also had, all the other ones had to do with norovirus, which norovirus is what people call the stomach flu, which there's no such thing, but gastroenteritis, the throwing up, the unpleasantries. And the reason why those happen in restaurants is because someone is working when they're sick. So I always have to put in this plug. Paid sick leave is good public health. Because if you have to work to feed your kids, or you have to work so you don't get fired, you're going to work. You're going to pretend like you're sick because you went out partying the night before. You're going to pretend, that you're not sick. And those cause outbreaks. So it's very important that we realize what is actually causing the foodborne outbreaks. Okay, they do, down in the bottom, you can see that lovely little tattoo down there. They also inspect body art facilities. And Champaign County was one of the first in Illinois to even do this. And we started inspecting them long before the state made it required. And I have to tell you how we started doing this. The body artist came to us and asked for that. And that's very unusual, but they asked for how to do it safely and how to do it properly. And so now, now it's statewide. They do in the county, there's no really potable water issues in any towns where you have a municipal sewer and you have municipal water. But in the county, there are a lot of places that have that. Of course, we can only look to Cherry Orchard excitement to know that despite regulations, despite laws, despite common sense, sometimes people are not going to follow the rules, and it can put the public's health in danger. A really big part of this division is the vector surveillance and control. That is your mosquitoes, your ticks. It used to be that there wasn't a lot really going on, but as the place warms up, we're starting to get more and different insects coming in. Not all mosquitoes transmit all diseases. So there are different types of mosquitoes, there are different types of ticks, and they all do different things. So we actually do surveillance on dead birds. We do surveillance on different types of mosquitoes. And last year we found one Asian tiger mosquito, which you're like, oh, no one cares. Well, actually it is kind of interesting because it was the first one ever found here, and this year we found around 50 of them. So what that tells us is Asian tiger mosquitoes are here, and they're going to be here, and they carry different things than the Culex mosquitoes that carry West Nile. So, all right. Aren't I a ball of fun? Is anybody going to have difficulty sleeping tonight, you think? Okay, here's a happy one. It has a baby on it. Okay, the Maternal and Child Health Department, or division. This is our biggest division. It has the WIC program, which is the Women, Infant, and Children Supplemental Food Program, family case management, child immunizations, breastfeeding support, and pregnancy testing. This is a very large division, and the whole point of this division is to have better outcomes for infants, better outcomes for children, and that includes, proper nutrition, things like that. And they are very creative in this division, and they do all kinds of neat things. Okay, Division of Wellness and Health Promotion. This one has the Illinois Breast and Cervical Cancer Program, the Illinois Wise Woman Program, which is basically cardiovascular risk factors and working kind of like IBCCP to address those preventatively. Tobacco prevention and cessation programs, sexuality education, pregnancy prevention, that type of thing in the schools. And then the CATCH program, coordinated approach to child health, the dental program, and vision and hearing screenings for children. The dental program, we have a very, very, very large dental program. It is, and I can say that this has improved drastically over the years because it used to be not something that I think I would be proud of. It is something I'm proud of now. They have, they do services in the schools for the fluoride in the schools, the dental sealants in the schools, and exams in the schools. And we also have 5 dental operatories at our building on Kenyon Road and 2 at the Urbana School Health Center. And this is a very large program, and pretty much any child with Medicaid in Champaign and Urbana come here for dental care. We also do things with infants, and I cannot wait to get this data. I'm very excited about it in a few years because we're putting fluoride on babies at age 1, fluoride on their little teeth when they pop through, and we cannot wait to see if this is going to impact, further down the line, and we will certainly be able to see that. And we are also pushing really big to let people know to get their babies to the dentist as soon as they turn 1 year old, which is certainly something I didn't know, but it is, studies have shown that that is very, very helpful. We have mobile services. This is our large mobile. You may have seen this thing out running around. It's out all over the place. And it has an exam room in the back that can be turned into STD clinic. It could be turned into a dental office. It could do vision screening out of it. The back office could be turned into anything. We have used this for all kinds of activities, including an emergency command center. We've used it for, we let mental health use it during when there was a suicide of a child over in the Vermilion County area. We went over there, and they used it as counseling offices, both of our mobiles, because they did a rally and there was a lot of mental health services needed at that time. We also have the little mobile, and it is 2 counseling offices is what is involved in there, and both have a little waiting room. We take it out at 2 in the morning at gay bars. We take it into public housing. We take it to churches, and when I say it, both of them we actually take out. Special events, we take it out to migrant sites. The soup kitchen, we're there at the soup kitchen every single week, the one Daily Bread Soup Kitchen. And we use it for outbreaks. We have used it when there was a syphilis outbreak. We had it out till 2 in the morning outside of the gay bar in town here. Well, at the time there was only one, but we had it out there, and the bar worked really closely with us to really get people to get out there. It just so happened the syphilis outbreak was in gay men, and they worked with us to get the people out there and get them tested. So it's really, really collaborative. We also have it at the schools. We do services outside of both Champaign high schools, outside of Urbana High School, outside of Rantoul High School, and we just got some statistics that indicate that we may be looking toward doing it at Unity as well. Okay, what other services do? We do emergency preparedness, and of course this really ramped up after 9/11 and the anthrax mailings. We do vital records, and we have something at CUPHD which no one knows about unless you work at the U of I or Harvard or Columbia or some of the other agencies that we've partnered with. But we have something called Public Health Institute for Research and Excellence, and that is our research arm of it. Dr. Gullerud may remember I'm a big fan of doing research, so we have this section, and we what we were finding was a lot of university programs wanted to do research at public health. Well, their research often was completely unrealistic, and it was not in anything relevant to what our clients would need or would help, and they didn't really understand it. So we developed this to really work closely with them and partner with them, and it ends up, it's been an amazing thing. We have people working from universities all over the country partnering with us on different types of research, and it's stuff that directly benefits clients, not just something to get someone published, although we don't mind that either. Okay, I'm going to real quick go over the 10 greatest public health achievements in light of the fact that it is our 75th anniversary, and just to let you know that the key of public health always is and always will be, always has been, regulation. Look at immunization. Again, immunization would not work if it were not for the fact that you have to be immunized to go to school. If that wasn't the case, there would be no herd immunity, and we would still be seeing these hideous diseases that thankfully, probably all of us in the room, except for you in the back, probably everyone has had, measles, mumps, rubella, chickenpox. We all had that. Mumps, that was dreadful. But, you don't have to have that. Kids don't even know what this is anymore, and that's an amazing thing. And that is not just because there are the immunizations, it's because people are required to get the immunizations. And even the people who refuse immunizations, they are still benefiting greatly from the herd immunity of the vast majority that do. So you see, some of the different vaccines that are out there. They're constantly developing new and different vaccines based on the need. The new one that they're working on that I'm excited about is norovirus. Not only am I excited because we have a lot of outbreaks related to this, I'm excited because I was just recently hospitalized with a foodborne outbreak. Yes, oh, the irony, I know. It's very irritating. We have safer workplaces. People don't usually think of that having to do with public health, but it does, and that's exactly where it started, and that's where OSHA, evolved from. Department of Labor, CDC, NIOSH, all of those rules and regulations have to do with keeping people safer on the job. You see up there I've got something about like asbestos, black lung, and all that. Usually something happens, and then the legislation follows. Rarely do we get, because of public opinion, rarely do you get a chance to get ahead of the game. And just like with this, with the compounding pharmacies and the issue with the fungus essentially in there, there will be legislation to follow. But again, it's too late for a lot of people. Safer and healthier food. This has been just absolutely key. And it's not only the fact that there is safer food because of the regulations regarding it. It also is the fact that there used to be pellagra, and kids had that dreadful thing, and then they started adding niacin to bread, and then there used to be the whole deal with goiter. Everybody had goiter. Well, now they don't because there's iodine and salt. So they were able to actually change the entire health of the nation by adding things to our food. Of course, the key one is pasteurization of milk. And in researching some stuff for the 75th anniversary, I ran into some fun pictures, and one was from a dairy in Danville, and has the milk caps that what used to snap on top of the glass bottles, and it said on the cap, "Milk from tuberculosis-free cows." Oh. Now that's a selling point right there. You do want your milk from tuberculosis-free cows. But again, that has to do with pasteurization. You don't worry about that anymore. Motor vehicle safety. Again, people don't really think of that as public health, but of course it is. There used to be, there were no seat belts in cars. It used to be that you'd bust a glass of a car and it was like shards of glass. Now it busts into that little puzzly looking stuff. Safety glass, speed limits, helmet laws, seatbelt laws, campaigning against drunk driving, all that starts out as public health interventions and then often is codified in some type of law. The biggest public health achievement ever, as far as I'm concerned, is the eradication of smallpox. That is just an absolutely amazing story, and if you ever want to read something fascinating, read about how that was done, because it ended up being done using children. The last remaining bits of vaccination was done by children. They gave them a penny a vaccine. And they gave them the little needles, of course. I hope they gave them a lot of needles, or we might have hepatitis outbreak. But they gave them the needles, and they went around and they vaccinated people. And they were paid to tell if someone had these symptoms. So they would go around to the villages. So it's truly an amazing story. And of course, that was the Centers for Disease Control that did that. And they are working now very, very hard for the eradication of polio, which would be absolutely amazing. Wild type polio. That would be just amazing to be able to get rid of that. So again, if anyone wants some interesting books, I have lots and lots of them because I just find it completely fascinating. An issue that we don't worry about in the U.S. is rabies. We hardly ever worry about rabies. In other countries, you are very concerned if a dog is coming toward you because the dog will probably have rabies. We don't worry about that because it's a public health intervention, but it's done through mandatory pet vaccination. We still do have issues with rabies, lots of issues, and it usually involves people trying to catch a bat. Don't do this. If you have a bat in your home, do not mess with it because it will bite you and it will get away, and then we're going to have to make you get rabies shots. Don't do that. But it usually involves bats. That is the common thing around here. And then, of course, I mentioned TB, HIV and AIDS. The reason why I went to work at public health as an intern with my BSW program is because of working with AIDS. Joan Lathrop, at the time, was the only person who did anything with AIDS in this area. And when I came to school, that's what I wanted to work with, and that's what I did for the first big part of my career. But I went to work with her, and I instantly fell in love with public health. I loved it. And public health and social work are so similar, both based in social justice. Both have the macro approach to looking at how to address issues. So that's pretty neat. And I have to say that, again, Champaign was on the cutting edge of that because we did HIV when no one else would take it on. And by we, I mean Joan. I didn't really have anything to do with it back then, but she took it on when no one else was taking it on, and that's pretty impressive. Okay, decline in coronary heart disease and stroke. Unfortunately, making a decline, and now with the obesity, whoop, we're not doing so good in that again. So I'll be talking about that here in a second. Family planning, people don't think about that, but it's key to public health, key. Countries typically, you always think about countries that have the large families, lower life expectancy. And so family planning options are key to furthering public health. Recognition of tobacco as a health hazard, and this always amazes me. It was actually the year I was born, 1964, that it was put out there that smoking is a public health hazard. It is a hazard to your health, and the warning label started coming out and all the interventions. And now we're up to, 2012, and people are still smoking, albeit a lot less. But I watched a movie this weekend from the 50s, A Woman Possessed. Every single person in that movie smoked. And I mean, they were just going to town. It was as if the whole movie was about cigarettes. So a lot of things, and that's changing culture, because that was very common then. Now, if somebody would smoke in a movie, you'd think, well, that's weird. And you don't see people smoking, and as we change the culture, it just becomes less and less likely that people will take it up to begin with. Healthier mothers and babies, this is a cornerstone of public health, of course, and it started out with visiting nurses, visiting with the babies out in the homes, and even I just got something, and I've got it on the back there if anybody would like to look at it, or think Betty, it's still back there, but it has to do with our 1960 annual health report at Public Health, and it was kind of neat. It showed one of the nurses going in. It said a common thing was to go in and teach the moms how to, bathe the babies and handle the babies, which I find that really interesting, because apparently my parents did not know how to give me a bath. Okay, fluoridation of the drinking water. This is a big one, and there's a big movement out there of people trying to stop fluoridation of drinking water. Don't do that. That would be a bad idea, because that is a significant, has had significant impact on the amount of dental caries, which of course causes all kinds of other health-related issues. People do not think of their oral health being related to their health. It is very important. Okay, where are we going in the future? When I say public health, I'm specifically referring to Champaign-Urbana Public Health District. Where are we going in the future? Well, we will continue with our core services. And remember, our core services are safe food, safe water, septic, and surveillance of communicable diseases. No matter what else happens, if H1N1 happens and we're dealing with that, all the time, these 4 core services will continue. We will never stop those. That is if everything else went away, those would have to remain. Also, we are continuing and upping surveillance of emerging and re-emerging diseases. We're having a lot of things emerge because they always emerge. They come over from animals, or they are imported, or whatever. They come from different places. Something mutates and changes. But we're also dealing with re-emerging illnesses. Whooping cough. There's something I didn't think we would be dealing with, but we are. And again, it has to do with lowering vaccination rates. And the more loopholes they allow people to get through those, then the more likelihood that we're going to have an outbreak. So now you all know if you have a grandbaby or a baby you're going to be around, you have to get the whooping cough vaccination, because the baby can't take that until they're 6 months old, and it can be deadly for infants. So, now when you go in and you get your tetanus shot, everybody has to get your tetanus shot every 10 years, or when you have the unfortunate, accident that you have to go in and get one. What you're really getting with tetanus is it's always been tetanus and diphtheria. Now what you're going to get is tetanus, diphtheria, and pertussis, whooping cough. Those will all be in there. So again, if you haven't had the whooping cough vaccine and you're going to be around babies, you need to consider that. Violence prevention, that is something that came out in our 5-year community plan. So we're going to be working on that. You may know that we just worked with the Urbana Police and a lot of other police agencies and the Sunnycrest Church or something, I can't remember the name of it. But anyway, we did the gun buyback program, and that was hosted at CU Public Health. And Stone Creek, there you go, Stone Creek Church. And that went very well. I was completely shocked at the number of firearms that came in from that. We also work on ensuring that people have access to health care. That is a constant struggle in this community. It has shown up in our I-Plan for years. It's something that's hopefully will be getting better in the near future. And we work on accident prevention. That involves whether it's drunk driving, wearing seat belts, car seats. We give out through Safe Kids Coalition, hundreds and hundreds of car seats a year in all the different sizes. And our big thing is obesity and obesity-related illnesses. I just want to real quick tell you some of the emerging diseases and re-emerging diseases because I want to ensure that none of you can sleep tonight. But what we're concerned about is H5N1, of course, or any type of flu that mutates in a way that makes it virulent, deadly, and very infectious. That always scares public health. That always scares anyone who knows anything about the 1918 flu pandemic. It's very, very scary. So we're always, they're always doing surveillance of that. And just for the record, because I get so many questions about this, every single flu has a number. It has an H and a number and an N and a number. That doesn't really mean anything. I mean, it means something, but it's not something you need to be concerned about if you hear like a number. They all have numbers. The media has just discovered that they have numbers. There's TB, and then there's multi-drug resistant TB, which scares me. Had we been dealing with that on the non-compliant case we had, we would have been in a mess, because by the time we could get that person into isolation where he was unable to move, 20 other people had been infected. And then there's extensively drug-resistant TB. If you have extensively drug-resistant TB, you will die from extensively drug-resistant TB, because that essentially means there's nothing that can treat it. With multi-drug-resistant TB, it can be treated, but it's much, much more difficult. We worry about bioterrorism of any sort, but we also I worry even more about bioerror. And that means that there's all kinds of stuff out there, and that somebody could let the genie out of the bottle at some point. Somebody could let something loose or get into something or be infected with something and spread it without knowing what was going on. We have the we have the distinction of having the only case of cowpox in Northern America, and that was due to a lab accident. And luckily there was no spread contained, but we do not know what is in, I do not know what that's doing. We do not know what's out there that could be, oh, you can fix that for me. We don't know what's out there that could be in labs and whatever. Uh-oh. I'm down to the one with the chicken on it, if that's helpful.
He's looking.
Uh-huh.
When you talked about immunizations and worrying about, I think it was Oregon, that has a low number of vaccines. Why do those particular areas have lower immunization rates?
It all has to do with laws. Regulation. It's again, if you're not mandated to do something, you're not going to do it. That means they have more loopholes basically, and more people are opting out of the vaccination. And then of course you will see the results of that. Some of these places are unfortunate case studies is what they are, because we will be watching of course what goes on there, and we will see that there are problems. Okay, if I can get back to my little chicken slide. Okay, some other things that we're worried about are drug-resistant STDs and HIV, that it can no longer be treated and that can be spread. Drug-resistant foodborne illnesses, and then the vector-borne illnesses, and I talked about that, a new one that's like with global warming, everything's creeping up. And those of you who garden know that recently the little gardening, that little chart that shows you when you can plant or what zone you're in, that's recently changed. It's getting warmer, and it's not just getting warmer here, it's getting warmer, it's moving up, and when things get warmer, different bugs come up, different things live longer, and we're going to start seeing some results of that. Ehrlichiosis is a good one. Lone Star ticks are starting to be around here, and there have been several cases of ehrlichiosis in like the St. Louis region, down southern Illinois, and they're just moving up.
What Chagas disease too?
Chagas disease. Now, the deal with Chagas disease is that is carried by the kissing bugs, which people are like, oh, I recognize that bug. Yeah, because they're all over the place now. But again, if the bug is not infected with something, it's not going to pass it to you. But they are capable of carrying it. So these insects that are capable of spreading different things, and of course, one of the scary ones is of course yellow fever. Anybody who's read anything about that knows that was very unpleasant. So as the climate changes, all kinds of things are changing.
What are these two?
Ehrlichiosis, it's a bacterial disease that you'll get from being bitten by the Lone Star tick. And there was just a new one that just about a month ago, Heartland, they're calling it Heartland disease, and it's from being spread from a tick, a different kind of tick. So we don't even know what's out there. That's the thing. So, wear your DEET. Wear your DEET when you're outside.
Have we ever had much Lyme disease here?
We have had some Lyme disease, but not a lot of it. Not a lot of it. Okay, this is the big thing we're working on, and it is obesity, because we have become a culture that does not even know what a healthy BMI, body mass index, we don't even know what it looks like, because we're so used to seeing us Americans get bigger, 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 that we don't even recognize. A body mass index, that number you get from your doctor, does not mean, oh, this is the weight I look good at. It means this is the weight at which your body is functioning the best, and you're going to be the healthiest. You're not going to have all these, issues. I love this little cartoon because it says one prescription for reducing the healthcare costs in America, and he's giving America the lock for the fridge. He says it's for your fridge. You got to start dealing with that. I want to show you this little thing, because this is what I'm talking about. This is in just the past few years how we have become just almost desensitized to what it is. This is the map of obesity from 1987. Every time you see the numbers change, what you're seeing there is another year go by. And we're getting fatter, and we're getting fatter, and we're getting fatter. Here it is, 15 to 19%. Oh, 1995, look at that. 1996. Oop, had to add another one in 97. Now those states are more than 20% of the population is obese. Keep going, keep going. Oop, had to add another one. Oop, we're going to add another color here in a minute. It's 2003, 2004. Look at how America has changed, and we don't even notice it. It's so pervasive that we don't even notice it. Okay, so essentially what I'm trying to say is we're fat. So I've got that up there. So we're fat. What are we doing about it? And it's, public health, everybody is kind of in this mode now where we're trying to do something to affect community change, community transformation. It's the same way with the not wearing seatbelts. When I was a kid, not only did I not wear a seatbelt, but sometimes I laid in the back window of the car. My parents should probably be in jail. I don't know. But I literally laid in the back window of the car. Nobody thought anything of it. Today, if no kid would get in my car without immediately, they know to put on their seatbelt. It's a culture change. I would never drive anywhere without putting my seatbelt on. It's a culture change. So when I was a kid, people used to throw trash out of the car window. You'd drive down the highway and people would be chucking trash out of their car windows. You don't. They do, but it's not as bad. And you look like disgusted at them when they do it. And that's a cultural change. Smoking, the reduction in smoking is a cultural change. We have to do the same thing with obesity. We have to do it. We do not have a choice. It is wrecking our healthcare system. The amount that we are spending on obesity-related illnesses is staggering. We have the I plan, and needless to say, obesity came out as #1 factor that we're dealing with. And we're working with CUPHD families that's been around for about 5 years now, and trying to get them to be a 501c3 agency so that they can raise money and start helping the schools to get things into the school. The schools are overwhelmed. You all know that. They're just completely overwhelmed with all they have to do. And somebody somewhere along the line thought it would be a brilliant idea to cut PE and to shorten lunch hours and to make kids sit there more. And we wonder why they're so, have so many behavioral issues. They're not getting to do what is natural to them, and that is to move. So the schools, we have had a tremendous amount of support from Champaign schools. They have just taken this on, and I should say Champaign County schools, not Champaign schools. And a lot of these have taken them on, but they need help. They need money to get these things in there. Some of the places we went and did an assessment did not even have balls or things to play with at lunch hours or recess or PE. That's unacceptable. That's unacceptable. And we need to help them. We need to get this stuff in there. We just got two community transformation grants. It's $800,000 over the next 4 years. We have a very, very large group in this community that is working on this. Governments, Carl, Christie, Pravina, Francis Nelson, the schools. We've got University of Illinois, Parkland, all kinds of places are working together on this to start helping to change the culture in our community. And we're going to see, this is the first time in a very, very long time where I felt hopeful that we are really, truly going to see a turnaround. And I do think that we are. It's going to take a lot of work. As you see on this map, we didn't realize that was happening because you don't realize it. It's like insidious. It just kind of happens and you don't notice it.
Look, our dress sizes were going down.
Right. That's right. That's right. They're resizing things. They're making things bigger. And it's this whole culture. And again, it's not as easy as us just saying, we need to lose weight, we need to exercise. We really have to focus on the kids because the kids are being bombarded with all types of things that are encouraging them to eat and encouraging them to do unhealthy things and encouraging this. And we are fighting against that. And I can assure you that my budget is a little bit smaller than the sugar sweetened beverage industry, for example, or the fast food industries or places like that. So it's really going to take a community working together, get healthy, accessible foods. Champaign County has done an amazing job already in getting all kinds of gardening projects going. It is so encouraging. There are gardens springing up everywhere. People are taking food to the food pantries. People are helping to get healthier food everywhere, into the schools, into their neighbors, anybody that needs help. It's not just, macaroni and cheese now. It's all I'll probably get sued for that. But it's getting the healthy and the fresh foods out there. So that is key and that is important. So that's pretty much what I've got for you. Does anybody have some questions for me? Yes?
I'm very glad that you could evangelize about the last issue, and stuff like that. I'd
me ask you about food inspection and restaurant inspection
Mm-hmm.
and everything. And I haven't completely followed it, but if we want to know our restaurant is safe, how do we know our restaurant is safe?
The doors are open. The short answer is the doors are open. If we go to a restaurant for an inspection and it is shut, then we've closed it down. Right now, there's no law. They can close it and say we're having a private party. We might have shut them down, but there's nothing to make them post that on the board. We're getting ready to change that. We're getting ready to go to a system, a color-coded system. People will actually be able to see the inspections, but that will require both Champaign-Urbana Public Health District ordinance, County Board of Health ordinance, and a county board passing the ordinance. And it looks like, we're definitely moving toward that. But you can never, if you go to a restaurant and you get sick, you have a very much more likelihood of getting sick from not washing your hands than you do from anything else. Because the food in general, food is safe. You're getting something into your body through your mouth. Most of the time it's coming in on your own hands. And I always like to tell people, and I've told the reporters this when they're dealing with these, everybody wants to blame the restaurant. It's usually either, like I said, a sick worker or an ingredient coming in that they really have no control over. And that has to do with our food industry. The places are getting bigger and bigger and bigger and bigger and bigger. If you're drinking milk out of your own cow at home, you pretty much know where that cow's been. You can control how, if you clean it before you get the milk, whatever. When you're getting it from these giant, factory farms or whatever, and it's all being funneled into the same thing, and we have an outbreak. Just look at the peanut butter one recall we just had. That thing started out with, this peanut butter. Oh, wait, that peanut butter these peanuts were in, it gets bigger and bigger. Even dog treats were involved.
Well, when you talk about washing your hands, I saw a sign at a restaurant one place that I'm really surprised that more places don't do. It has the usual employees must wash their hands. And then also it said, and it's not such a bad idea for you to do it too.
Yeah, I think that's funny. And that is true. And if you go and you sit in a restaurant, just sit there sometime. Go get yourself a cup of coffee, sit in there, watch how many people come in and how many go to the restroom first to wash their hands. You will be shocked. People just don't do it, and they always want to blame the restaurant. You always want to blame, and we always do like a 3-day food history, and the reason why that is, we get calls all the time. I got sick at this restaurant. Well, when we do the 3-day food history and we go through some things, we can find out that, oh wait, maybe you got sick at a restaurant, but it wasn't that one, it was this one, because we've got a cluster there. So I gave you a little form, or not a little form, a little paper that says how to connect with us on social media, and check out our website because we have a really useful dynamic website. You can make a foodborne illness complaint. If you get norovirus, report it. Let us know. We'll do the 3-day food history, and we'll see if we have others coming in. That's how we start to investigate these things. But you can make a smoking complaint. If you see someone smoking in a building or smoking too close to the building, give us a call. We go out, we investigate those things. But short answer on the restaurants, if it's open, they have passed their inspections and they are trained properly and they know what they can do. Does that mean you're not going to get sick from something? No. And I tell people you can have the most, pathogen-free piece of food in front of you and you touch it with your dirty hands, you're going to get sick. So, and also, if you're not too busy, could you go ahead and get that paid sick leave for people? That would really help us out a lot. You had a question?
How effective is the hand sanitizer?
It's effective. It's effective if your hands are not, if they're not visibly soiled. If they're visibly soiled, you need to go ahead and wash your hands. But it kills the germs on there. So if people, if people use the hand sanitizer before they eat, that's great. But I have actually been in a restaurant where I've seen someone who does not wash their hands, does not use a hand sanitizer, eats and then uses a hand sanitizer. I'm like, oh, well, that's not going to help you, Barb.
Could you give us an update on the Cherry Orchard facility?
Julie, could you repeat the question?
Sure. Barb asked what is going on with the Cherry Orchard situation. Cherry Orchard is an apartment complex up in unincorporated Rantoul, Thomasboro. It's kind of out in the country. And what happened is we got a report. Well, we knew that they had septic systems that were basically just not functioning and pumping out raw sewage. And long story short, we ended up closing them down, boarding it up, and through the court system, getting it boarded up, And then we've had various things where people have moved in and moved back out, moved in, moved back out, even though the places were boarded up. But right now the place is empty, it is boarded up. I know that that the owner of a piece of that property is trying to get it rezoned again because it's now reverted back to a different type of zoning. And it is a mess up there. That's what I can say without a doubt. I was just up there recently and it was just an absolute mess. It is still closed down. I have heard various things about being in foreclosure and whatever, and I always get calls from the state's attorney, you know, wanting to know what the status of it, what's going on up there. And as far as public health is concerned, all we can do has to do with the septic system, and the septic system is still not fixed. So I don't care if they build the most beautiful building in the world up there. If they do not fix the septic system, public health will not allow them to open. So, Kathy, I'll get you.
Could you talk a little bit about the relationship between your office and the county office? Because this body had a good deal of interest in developing
Yes.
both of them, actually.
We are the envy of the state because we have the Champaign Urbana Public Health District, which has been around forever, and we are a district. We are a unit of local government, and that means that we are our own taxing body and that we you know, if there's money left over, that money can be used. And this year, when the state didn't pay us, oh, big surprise. We knew that was going to happen. Other health departments laid off staff. They, you know, about closed, had all kinds of problems. We had funds reserved knowing full well that the state of Illinois occasionally makes us give them compulsory interest-free loans, and we do. So we were able to function. We contract with the County Board of Health to do the services in the county. So the whole county is covered. It's just, they're two separate boards. And it's the district board, which is by statute a certain way, and it's under the district law, and then the county board. And you know, they contract for services with CUPHD, who actually has, you know, all the staff. And as far as I'm concerned, it works out very well. There have been some bumpy things over the years, but you know, I am not one that's a fan of having just a county board of health. I mean, a county health department. That's everywhere in the state. There's only 3 districts. That's Stickney up by Chicago, East St. Louis, and Champaign-Urbana Public Health District. And we just happen to be very, very successful.
Actually, you're talking to the organization that got the local one, both of them started.
Oh, I know that and from the history, and that's why I was so excited to be talking to this group at the 75th anniversary, because, and it was women who started the public health district. It was women. It's interesting to read. What I would like to do is get that into some type of narrative form, because I think it will be a fascinating story. I just have not been able to get around to that yet. There's a lot of reading, but it's really interesting. But it was absolutely women that got it started.
You would be interested in league archives.
I have read some of the league archives online, because that's where a lot of this is. That's right. So, and who else? Somebody?
It's 1 o'clock. 2 more questions?
Sure. All right.
Ann Martello is asking.
Okay.
I wonder how many people are employed?
120 right now. We have 120 employees, and we have some contractual staff, and we have a lot of volunteers and interns and residents working with us. I'm getting ready to interview some social work interns tomorrow. We have nurses, we have residents, we have people from community health all over the place. So, 201 West Kenyon Road. It's by that old Gateway Studios Hotel. It's on a frontage road. It's the old Colwell Systems. And I want to, right now, before I forget, invite everyone on October 19th to come to the CU Public Health District open house for our 75th anniversary. I would love to give you a tour. If you think I'm talky up here, you should have me on a tour, because I am talky.
So that's Friday. a week
That's Friday from 2 to 4. Come out there, and I would love to give you the tour. And there will be 2-inch squares of cake.
We thank you for the cake.
Oh, you guys brought the cake.
Yes.
Okay.
You were the cake.
Oh. We had one more question here.
Yes, your inspectors judge the food facilities, restaurants on a 100-point scale, and I'm wondering how low can a restaurant go on the scale to be closed?
Very low. This is the problem with just posting a score, is it is not like anything that you would see any other place. It's not like a test score. It has to do with violations, critical violations, dangerous violations, in other words. If we go in, you can have 100%, and if we see something that's a critical violation that involves public safety, you'll be shut down right then. So that's why we can't just post the score. It's really meaningless. And that's why we've been trying and trying and trying to develop it. And our director of environmental health has come up with what I think is a really good system. And Betty Siegel knows about it because she's had to listen to it endlessly at board meetings. And I think we finally have got something that I'm really proud of. I think she's done a great job. Okay, thank you.
I bet you feel like I do when we have these programs where we have public officials talk to us. I'm just always blown away by the quality and the dedication of the public servants we have in the cities and the county. So thank you so much.
Thank you.